Hello, my name is Elena Garralda. I'm a medical oncologist and I lead the Early Drug Development Unit in Vall d'Hebron Hospital in Barcelona, Spain, and I'm also the project coordinator for the PragmaTIL study. We came up with the idea of this project because during the last years we have actually been working to build our own academic TIL project and TIL program in the center. And we know one of the challenges of actually administering TILs is administering the interleukin-2 after the TILs because of the toxicity that regular interleukin-2 has. So we came up with the pragmatic idea of could we administer TILs in another way that was less toxic? And this would mean changing the interleukin-2. We have been working in the unit with other interleukins, modified interleukins that have less toxicity. So that's why we came with the pragmatic idea to challenge the way TILs were administered. And we will do a randomized trial where some patients will receive TILs and the regular interleukin-2 versus other patients that will receive the TILs, but then will receive a modified interleukin-2, trying to get less toxicity. What excites me about this project is it's really multiple layers. One, it's really a very collaborative approach where we will be working with most of the important centers that are working on TILs throughout Europe. So it's a big collaboration between NKI Center, Harlev Center, Karolinska, Sheba Hospital in Israel, and ourselves. So we will be working with the people that have been really administering TILs during the last years in Europe, and this will be a very enriching experience. What excites me is that we can really change the paradigm of how we administer TILs, so the impact can be really important. This is the first time that this has been done, so we really have the capacity to perhaps show that we can administer TILs with less toxicity. The impact of this project has really multiple layers. In the first one, it's the first time that we are actually trying to give TILs with a modified interleukin-2. So if this is successful, we will have managed to give TILs with less toxicity. This will help other people receive TILs because one of the challenges is actually administering the interleukin-2. So this will make more people have access to these treatments that are really efficacious in certain tumor types such as melanoma, but we are starting to learn the efficacy in other tumor types. Then there's the impact on patients, and in this project we really have patient-reported outcomes as one of the endpoints, and we're really building a project where patients have a direct impact in the way the protocol is written. So this will empower patients and give more information to patients on TIL therapy. Then also in a logistical level, this is a project where we are actually going to administer TILs from the different hospitals in a pragmatic way. So from a regulatory perspective, this also sets a point of how this type of trials can be done in an academic environment where each of the hospitals will administer their own TILs. And this is also the first time that has been done. If there was one thing that I wanted to achieve with this protocol is actually answering the question that we are intended to answer in the beginning. So it's, can we really administer TILs in a way that we avoid the toxicities of interleukin-2 while maintaining the efficacy of TILs? If we really manage to answer this question, I think it will be really a huge advance in the field.